Thomas is going to introduce our speaker, and we have several more this semester. And we will be having lunch after as well.
All right, so this is my friend and colleague, Dr. Michelle Eichinger. She's a public health leader and urban planner. She has her expertise at the intersection of climate change, land use, and the health impact of both. Just understand she wrote this. This is all her humble bragging. So this is her extensive career in public health at the Delaware Division of Public Health, the Center for Disease Control and Prevention. As a public health advisor on the subject matter expert of health in the built environment. She recently spent time overseas in Europe conducting research of the climate change impact on environmental systems and infrastructure in both Europe and Africa. Currently, she's the director of research and data science at Orbis Inc. up in Charlotte, North Carolina, where I work with her.
I'm his boss.
Her education is, she has a master's of science in health promotion and a master's in public administration, a school that doesn't matter, and a PhD in planning design in the built environment from Clemson. She's an NSF fellow in resilient infrastructure and environmental systems, and I hope you all enjoy it.
Thank you so much. The school that he did not want to mention is the University of Delaware. So go Blue Hens. I'm sorry. I do have Delaware. Small state pride. Small state pride.
Yourself in the foot, all you want.
And it's a good course. You can see cows with holes in them. They do. All right. Well, thank you so much for coming. Actually, for my sake, I just want to get a feel for who's all here in terms of what your background is. So, how many of you are forestry? Like that's your bread and butter. And then what's the other one? Environmental conservation?
Wildlife.
Wildlife. Oh, really? Oh, what are you?
Natural resources.
Okay, good. Anyone like him?
I'm undergraduate.
Oh, okay. You matter. Okay, so I'm here to talk about ecosystems and healthy communities. And like Thomas says, my background is public health. I'm also an urban planner. So I do the mix of both, and you're probably wondering how the two mix. I got into the field of public health trying to save the world, save people's lives, because that's all we care about is like helping people and improve their lives, right? But I found that the education messages of the importance of eating healthy and being physically active and don't smoke, those messages can be meaningless if the environment doesn't support those messages. So it's one thing for me to tell like a population of, hey, it's important that you eat healthy, get some fresh fruits and vegetables. But if they live in an area that has no supermarket, their closest food retailer is a dollar store, those messages are meaningless. So you have to figure out, how can we design the environments? How can we design communities? How can we develop policies that promote healthy living? So that's how it all started, and it just evolved. Climate happened, and so I wanted to save the world again. So that's how it all started. How?
Oh, you probably just need to click on it. With the maps.
Oh.
Yeah, and then you should be able to advance with the keyboard if you want.
Okay. Well, this works.
You can use the keyboard now.
Okay, now I can use the keyboard. Okay, so I just want to do a brief overview of what I'm going to be discussing today. The connection of ecosystems, community health, and technology. I'm going to use the word community health and public health. They are two distinct disciplines. Well, public health is the overall umbrella term, but community health is actually a discipline of science in public health. It's looking at the community structure, community environment, infrastructure. So some of the objectives today, we're going to understand the relationship between healthy ecosystems and public health, or how data technology is transforming forestry and conservation, and discuss some implications for interventions and policies. So that's just a little brief overview of what we're going to talk about today. But before we start, what is public health? This is a question I'm asking you. Hi, what is public health? How's someone help her? What is public health? No. Pause, put that down. Performance review. No cheating. What is public health? Come on, give me some ideas. What do you think public health is?
The health of the public.
Okay. Very funny. Let's expand on that. What is public health? Come on. Are they all, or you guys are always quiet?
Yes.
Okay, we're gonna have to work on this because I'm not. Go
I
ahead.
like the well-being of the community as a whole,
Well-being.
and like in different realms of well-being, whether that's emotional, physical,
Oh, you're
financial.
touching the dimensions of health. Oh my God, you're so good. I mean, let's expand on that. Do you have anything to add?
I was thinking to say different, levels, so it could be like one community or the whole school.
Oh, he's talking about scale. So yeah, public health is are you taking a picture of me? Or are you cheating?
I'm sending it to Clarence.
Okay. He's talking about scale. That's very, so population, community has different scales. And he's talking about the individual level, at the family level, at the school level, at the neighborhood level. We all talk about public health in those scales, correct? Anyone else want to add?
Overall health of publics related to physical or social or emotional health.
I'm sorry, say that again?
Overall health of the public,
Yeah.
a community, maybe it's related to physical, social or emotional health.
With the dimensions of health, absolutely. I'm gonna help you out here. So public health, according to the World Health Organization, is the art and the science of preventing disease, prolonging life, and promoting health through the organized efforts of society. So when I say organized efforts of society, what does that mean? Who does that involve? This is important because you're probably wondering, why is a public health expert in your room right now? What is the organized efforts of society? Who does that involve?
Government.
Huh?
Government.
Government?
Everybody.
Okay, that's. Right.
Public health department are different stakeholders.
Yes, stakeholders. Broad, that's a broad term.
Yeah, so like maybe the hospital, maybe the NGOs, what working.
What if I told you that you are part of that organized effort? What if I told you that environmental agencies are part of that organized effort? What if I told you that the laboratory in the wildlife is part of that effort? These are an organized effort. So with that said, we have what's called the public health system. Okay, so public health system is this interconnected agencies, entities that aim to protect and improve the health of people and their communities by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. So remember when I told you, the reason why I started into the planning world is because I can't educate someone on healthy lifestyles if the environment doesn't support it, okay? Which means I had to work with transportation. I had to work with agriculture. I had to work with economic development. Those are entities that I had to work with because I am not in a capacity in public health to change land use policy and ordinances. That's not the role of public health. That's the role of planning. I'm not in the role of trying to get mass transit to get people to use another form of transportation. That's transportation. Does that make sense? Okay. So with that, made this little thing. The public health system includes all of these. Okay, can you guys read it? Okay, I want you to look at this and ask and tell me, is there any of these leaves that kind of look, I'm surprised by this, or like, what does this have to do with public health? Does any of these surprise you? Anything I'm kind of like, oh, I didn't realize. It never occurred in that sector never occurred to me. Any of them? Speak up.
Faith-based organizations.
Yeah. So wondering how that happened?
I mean, it's just a little outside the aspect of,
Can I just tell you, my first job in public health, my very first job in public health, I did HIV work. All right, in the state of Delaware, 1 in 50 people with HIV were Black. If I wanted to get into the community of Black, because clearly I don't have that color, I'm not the best messenger. So who did I reach out to? The Baptist churches and the parish nurse. A lot of these churches have parish nurse councils. So I worked with them like, hey, I need to work with you guys to send this message and start promoting testing and counseling. They were the better messenger. I was not the messenger. But if I want the message across, I worked with the faith-based. Okay. I did that with healthy eating as well. Food is a central part of of culture. And in a faith-based community, food brings people together. But in certain population groups, especially among the Black community, diabetes, type 2 diabetes, they're 2 times more likely to get that type 2 diabetes, largely diet-based. So who did I want to work closely with to get that message across and promote an environment for that? Faith-based communities. That's just an example. Okay. Anyone else? Good question. I like that. I will definitely be able to help support that. Anyone else? Any other surprises? Go ahead.
Economic development.
Huh?
Economic development.
Oh my goodness. I think COVID is a great example of what happens when a community is not healthy. The economy goes down. So for example, this is back when I was doing nutrition, physical activity, obesity. I worked closely with the Delaware Office of Economic Development, and they're probably like, well, what the hell, why? Well, they also were the recipients of the Main Street program. So it's a federal fund to promote lively main streets, mixed use. And how I looked at it is like, hey, if we can get mixed use design and active transportation, you're going to bring more people into these main street hubs. Now it's indirect, but if I get bikes, transit, everything is in walkable scale, that's all physical activity. I don't care how you get your physical activity. I just want you to move. And one of the easiest ways to move is through transportation, getting from point A to point B. So I worked with the Economic Development Office with our Main Street program to promote walkability because that is public health. Does that make sense?
What,
Anyone else? Yeah.
curious about how environmental organizations can work with this.
Oh, well, what do you think? Why do we want to support environment? Why do we care about environment? You guys all took ecology, right? What's the first law of ecology? Everything is connected to everything. Healthy environment is healthy public. And we'll talk a lot more about that. Good. You guys all get it? You are part of the public health system. Okay, good. We all got that. Okay, so I'm going to talk a little bit about ecosystems. Like, why do we care? Why do we care so much? All right. But well, I think one of the easiest examples is air and water quality. Like, that's an easy example. Fires burning, air pollution, emissions. That's public health. I was just sharing with Casey here. I have severe asthma. All right. I can't go to certain parts of Atlanta. I will have an asthma attack because the air quality is so bad. You go to some parts of California where the wind's going the wrong direction and the wildfires are going to cause an uptake in respiratory diseases and hospitalizations. Water quality, same idea. For water quality, waterborne infections, cholera, for example. So you all are working in the scope of some way of protecting the environment that includes air and water quality, not just for the critters, but for people as well. There's also mental and physical health benefits of green spaces. There's been so many studies about this, where if we engage in outdoor spaces that are green or green infrastructure, like parks, it's active recreation, but it also has that meditative qualities. It reduces blood pressure. It reduces cortisol levels, which is a stress hormone. So there's been tons of studies related to the relationship of being exposed to nature and mental health, okay, as well as physical health. And then how do we heard of One Health? Really? I'm actually kind of surprised by that. You guys don't talk about One Health in this department? Hi. Because you're late, I'm going to ask you a question. What is One Health?
Oh, I have no idea.
I'll help you. This is actually a very emerging, in Europe, it's already an established concept, but I think in this country, it's becoming more of an emerging topic, but it's very popular in the public health and veterinary fields. But One Health is a collaborative, this multi-sectoral transdisciplinary approach where the local, regional, national, global levels with the goal of achieving optimal health outcomes, recognizing the intersection between people, animals, and their shared environment. Okay? We have to share our space with the wildlife and the critters. We also have to share our space with the humans. It's that intersection. It's working with the veterinary science and working with public health to recognize the potential of zoonotic spillover. What is zoonotic spillover? Wildlife people, come on. What is zoonotic spillover?
Maybe something an animal carries that can transfer to humans.
She gets the A for today. Great, okay, that's exactly. So that, I mean, that's very important. So we see a lot of One Health focusing on this intersection of veterinary animal health and human health because we're seeing a lot more incidences of animals having to share the same space as human settlements, human habitats, largely because of deforestation, climate change, development, urbanization. We're seeing that. And so there's this potential of diseases that are carried by wildlife carrying over and spilling over to the human population and vice versa. It's not just one direction, it's both ways. And it's about that shared environment. So wanted to share this, you guys attention what is environmental sciences, restoration, stress recovery, environmental protection, reducing harm, environmental protection and maintenance, aesthetic. If it's very nice out, you're going to go out. If a park doesn't have any trees, no places to engage socially, people are not likely to use it. Okay? So that's the concept of ecosystems and human health. Any questions up to this point? Is this fascinating or what? You guys are all gonna be like public health experts at the end of this. Okay, this is an emerging thing. Have you heard of forest bathing? Raise your hand. It's so funny because it's like so popular, it's like an Eastern thing. But it's getting popular here. So this whole concept of forest bathing is like this medical therapeutic that we're trying to get people to, if they are experiencing anxiety or high levels of depression, we're trying to promote more, hey, get into nature. And the idea is that, like I said before, there's this big connection about nature exposure and human health, not just blood pressure, heart rate, but also mood. Okay, there's a lot of evidence out there about this nature exposure. So this concept of forest bathing is like this medical modality, medical treatment that's common in Eastern parts of Eastern Asia, and it's growing here. What do you think of this tree house, by the way? I stayed there. It was so much fun. That was in France. It was a lot of fun. All right. Let's talk about deforestation and degradation. I've mentioned some of this already. We're seeing habitats being lost due to certain industries. I'm an urban planner, so one of the things that we try to address in the planning world, it's really difficult in this country because there's so much space and all developers want to like, hey, we have this big, massive open space. Let's put a new development there with cul-de-sac. And it's really difficult because you're disrupting habitat. All right, we want to promote more infill development, redevelopment, but in this country, there's a lot of land, and unfortunately, it's cheap. Land is cheap. They develop in it, and people are wondering why they have bears in their backyard. Okay, but in some parts of the world, it's not just about development. It's the industry, it's mining, it's timber, it's logging, it's climate change. So what do we see? We're seeing effects of chronic disease and respiratory health. You know, trees are important. They help our air quality. We're seeing at higher rates of asthma and other respiratory diseases in certain parts of the world when there's lack of trees that exist. We're seeing vector-borne diseases. Okay, wildlife, what's vector-borne? What's vector-borne? What is a vector-borne? What is a vector? Yeah. Who said that? You. What's a vector?
You know.
Awesome. Okay. Did you know they carry diseases? Of course you did. You've heard of that, right? Ticks, Lyme disease, mosquitoes, malaria, among many others. But we are seeing areas that we don't typically see malaria. For an example, Southern Europe, we're seeing higher rates of malaria. Climate change. They don't have the habitat. They have to go somewhere else to survive and find other humans to suck blood. So we're seeing incidents of certain diseases in areas that we typically don't. And I talked about zoonotic spillover and emerging infectious diseases. Some examples of this is the COVID-19. There's, of course, controversy and speculation of where it came from, but initially the thought was wet markets in Wuhan, China. All right, when you mix animals and humans together in a shared environment, One Health, you have this higher risk of new infections. When you have a diseased animal and a susceptible human, that disease will jump species. And it'll be a novel disease for humans, which is problematic. Okay, we see this. Avian flu is another great example of why we have to manage avian influenza. Why? It does. It jumps people, and we've already seen that with some agricultural workers. You know, it's going into the flocks, and if people are interacting with them, some unfortunate people will get it. Okay, so it's very, 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 very essential that we are mindful of that shared environment. So I threw in some of these examples up here, talked about this, talked about wetlands, significant carbon, industrial agriculture and expansion, malaria risk goes up, Ebola, there are many things, poor air quality. So these are just examples. Are you guys getting the point now? How like environment and public health are like very much connected? You get it? Now you get it? Environment, you are public health practitioners, saving the critters and the people. So here's some other examples of climate change. You guys talk about climate change and its relationship with environmental sustainability, environmental impact, but it has a human health impact as well. And they coincide with environment. So we see the water and food supply, higher rates of malnutrition, diarrheal disease, algae blooms. We are seeing tons of algae blooms. I used to work in Boston. We had closed beaches. We're trying to get people to stay cool, be active, but stay cool because it's so hot out. But we have to close beaches because the algae blooms are so hot. This is the problem. Mental health. We have environmental refugees. We're seeing a lot of that, especially in certain parts where there's islands. People need to migrate. Waterborne diseases, allergies, vector-borne, air pollution. I told you about asthma, injuries, pedestrians. I say that because if you get more people walking, you have to design the community to support the structure. And then, of course, heat-related illness. So conservation efforts in community health. I wanted to talk about this for a couple of reasons. Why you, and how important you are in promoting health, but the role of in community engagement, okay? I'm a Girl Scout leader. I've been a Girl Scout leader for years, all right? I find them as little scientists and little stewards of environments. I look at them as like, if I can get these people to understand the importance of protecting the environment, that's a whole generation of people that will understand it and do some efforts. You kind of build that, right? You guys are all here for a reason. You guys all like me, tree huggers, right? Right? But it's not just like little stewards. We have so much data at our hands, the ability to collect data. With them knowing it and not knowing it, they are potentially participants in our ability to monitor environmental conditions, monitor personal health. How many of you have a Fitbit or something like that? Okay, I know you guys have a watch that like measures maybe how many steps you have. No? How about a phone that measures how many steps you have? We all have something without we realizing it. We have in the hands, we have technology to be able to monitor. Okay, so the importance of, looking at conservation efforts as community participation and environmental stewards in terms of not only raising awareness about the role of environment and health, but also potential participants in research, data collection. And I told you my first, you guys know this, right? This is not new information, the first law of ecology. You've heard that before, right? Yeah. Okay, good. And I also wanted to share with you. Genetic spillover. We want to protect the animals and all these little critters so we can protect human species. So yeah, this happens. Right. And I just want to share this picture. I love this. This is in Kenya. It's Nakuru. It's actually the edge of a volcano. It's pretty cool if you ever go there. Talk about environmental mecca. It's pretty awesome. So let's talk about some data. This is my favorite part. I love data. Numbers makes me happy. We in the public health world, whether you realize it or not, we are data savvy folks. We are all about where can we get this data? How can we collect this? How can we measure this? How can we use this to improve people's lives? That's our mindset, okay? I don't know if you guys knew that. How many public health people have you ever run into? It's all of you. So we have many forms of technology that's out there to help us collect data, okay? You guys, I just talked to Dr. Post this morning, drones, remote sensing, LiDAR, satellite imagery. But as I told you, palm of the right hand has a lot we can use, okay? So we have this Internet of Things. We can use sensors. There's citizen science applications. I don't know if any of you were around during the eclipse. It was here in 2017, full eclipse here. Did you know that NOAA encouraged anybody that was in the path to document it on their app? There was that was their way of collecting data, was through community participation, encouraging citizens. If you're in the path of the eclipse, take a picture of the sun safely, but document what time, where, it documented the GPS position, all of that, GPS. You guys are walking mobility devices. I mean, I can know where you are, how fast you go. We can look at acceleration. What your travel habits are. How often do you go through the Starbucks? I mean, that's how I track my daughter. You were just there, why am I giving you more money? So anyways, this is just examples. Sensors. Now, granted, I am an urban planner, so I tend to look at the urban scale, but very applicable in other scales. So we have environmental sensors that we can use not only to collect temperature, but we can collect relevant humidity. We can talk about oxygen levels. We can talk about particulate matter, especially when it comes to air quality. We can look at particulate matter. Look at sensors. I don't know if the EPA has them anymore. With the current, I think that data went away. There used to be sensors at a lot of airports, and you can actually measure air quality, look at the particulate matter at different airports. And the idea is do we want to build a neighborhood in this area within the PM being so high? So you can have particulate matter, nitrogen oxide, let's see. Yeah, you can have temperature, carbon dioxide, volatile organic chemicals, stuff like that. And then you have the human scale. I told you, right here. My phone can tell me, actually, I'm probably doing this, it's probably like, oh my God, she's moving so much. Don't do that. So we have the technology, is using that data and using it to better understand how humans interact with the environment and how the environment impacts humans. So I'm now going to talk about little fun stuff to do with data. So now that you have all this data, what can you do with it? Fun stuff. I'm only going to show 2 examples. Thomas, I did steal some of your stuff. Our stuff. Yeah. But I also want to share a project that I was involved with when I was in Africa, using a different mode of analysis. So we can do some predictive modeling, scenario analysis to examine ecosystem changes. We can do risk assessments, using data technology. So I'm giving you some examples here. I'm only going to focus on Bayesian belief networks. How many of you heard of Bayesian modeling? You're familiar with it? Okay. Does this look familiar? Do you remember what this is called?
No, go on, please.
What is this? Is an example of?
Roster.
Oh, it's Forestry, yeah. Because convolutional neural networks. Okay. I want to give you a couple of examples. I'm going to start with the case example using Bayesian modeling. Now, mind you, understand that this specific example, this paper that I was part of, the study, focused more specifically on food and environment. Okay, so, but just know that it's very much applicable to other industries. Okay, just know that this is when I'm doing food. Okay, so this is called, these little structures are called directed acyclic graph DAGs. Okay, so what happens is you have these constructs of variables, right? And the idea is that we know the relationship between one variable and another is going to affect an outcome, whatever that outcome is. In this case, we're looking at diet choice. Unhealthy versus healthy, okay? I told you before, I can tell someone to the blue face about the importance of eating healthy, but if the environment doesn't support it, it's a very difficult message to keep, okay? And there's many factors that influence diet, right? And I have these constructs, neighborhood, this the environment, the built environment. This is more of food retail environment and transit, so accessibility, getting from point A to point B. Okay, sources of income is in here, socioeconomic, and then here is at the household level. Do you have a kitchen? This is an issue in certain parts of Africa, not every group. Even here, there's people who don't have a fridge, don't have a microwave, okay? That all contributes to what you eat, right? So anyway, we pull some examples of neighborhood safety. Okay, is there a lot of crime? Source of income, do they get a salary? Do they get a pension? Do they get some kind of government assistance? Income, what's their income level per month? Now this is in Rand, the South African Rand. Do they have experience with high food insecurity or low food insecurity? Food insecurity is having enough to eat. That's the simple way of saying it. And then how much they spend on food. And how does that influence their diet choice? So the way Bayesian models go is that you have all these variables, all right? And you're coming up with conditional tables. Probabilistic, it's all about probability. So if they have a high rate of crime, they're less likely to walk to an outlet, which means they're taking a bus, which limits how much they can carry at the grocery store. Does that make sense? It determines how many trips they have to make. Now, if you go in this country, transit's not great. Sometimes you have to allow 3 hours to get from your home to a desired supermarket because you have this transit transfer delays, and then walk the last mile. It also limits how much you can carry. So that, these are all connected, all right? So you have these probabilistic tables into what's called a DAG, a Bayesian network. Okay, it seems really complicated, but there is a software for that. You just make a table and just the software do the magic. What's different about this study is that we added a spatial dimension to it. So typically Bayesian models are not in a spatial realm. So what we did was take the neighborhood. This is a town, it's in Worcester, South Africa. So in the Greater Valley, so it's like right here. It's like 120 kilometers north of Cape Town. It is known for the wine. It is a wine region. So every time you've had any South African wine, I can almost guarantee you it's from like up here. Okay? No joke. Okay, you go to Europe, you want to eat apples, it's from this area too. Okay, it's all from this area. So like this is a huge agricultural area. Okay. And I'll tell you about the irony of huge agriculture area, and then they also have this huge malnutrition and food insecurity. There's this paradox. But anyways, we take this neighborhood or the town and break it up by neighborhoods. We found that there's significant income level and racial segregation. It is embedded. It's not even a hidden thing. It is very obvious. This area, I'm going to tell you right now, is an informal settlement. There is no infrastructure. It's people building their own homes out of corrugated metal. Okay, there is no waste, there is no public water, none of that exists in this area. So you get to see income is the highest here, north of the highway. It gets a little bit integrated here, and then you have these segregated areas. So what happened was we then blocked those and been able to determine what are the probabilities of food insecurity in these little areas? What's the average income, monthly income in those areas? What is the transit system like in these areas? So you get the idea, like we're to measure it. So take that Bayesian model and then connect it to the blocks. Now, granted, this is an example of nutrition, but you get the idea. You can apply this in other industries as well. But it's a tool that you can use. This is what's so exciting about it. Instead of doing an experiment and wait 3 years to see what happens, like if I did a policy change, we're hoping that policy change will be effective, but we won't know until 5 years, 10 years from now. The idea of this is that if I were to change this, a part of the condition table, like let's say like I introduced a new grocery store, okay, in here. We'll call it, over there, they wouldn't call it a grocery store, they'll call it a spaza. A spaza, which is an informal retailer, and we'll say that informal retailer will sell nothing but fruits and vegetables, okay? If we were to do that, let's play with the model. If we change that part, what will that do for diet choices? Will we see an increase in healthy choices here? So it's almost like this virtual scenario analysis where you could test policies, test changes of the land use, environmental conservation efforts. What would it do to the entire system? Will you make a difference 5 years from now, 10 years from now? So you can actually do a temporal scale on this. We did not do a temporal scale on this, but you can add a temporal scale to this. Does that make sense? So it's a model where I get excited about it because it's like, oh my goodness, I don't have to apply for funding to do this policy and hope it changes, hope the world changes. We can test it, right? What was nice about this system was that we actually worked directly with the community in collecting the data. It's their community, it's their environment, it's their choices, it's their money. What would be best for them? So when we collected the data to develop the probability tables, we worked with the community. We had them collect the data, sampling in different areas. We worked with the stakeholders, including economic development was very much part of it. Waste management, environmental, they were all part of it. They were all part of the co-creation of knowledge so that we can develop co-development of interventions. So that's Bayesian modeling. Isn't that exciting? Am I the only one excited about this? All right, it's life-changing. All right, let's talk about convolutional neural networks. Let's talk about artificial intelligence. All right, so here's another example, and I had to use this example because your friend here helped create this. And so we're using this in some of our work to help the timber industry in this country be ready for market in the European market with the new regulations that was developed by the Green Deal in Europe, the European Union deforestation regulation. So we had to figure out a way efficiently to track and trace where harvests are being made. Okay, so one way to do that is use artificial intelligence. So what does that mean? We classify an image. This is a very simplistic way of thinking this, okay? It's a little bit more complex in real life, but we got this. So you take, what happens is you take pieces of the image as your input, and it kind of it classifies it, and then it kind of learns, and this is a reiteration, it continues, right? Until it knows the pattern. in this case, the color bands, RGB, it reiterates until it learns it, right? And then we train it to like, well, this area is hardwood. This area is water. This is a road. This is a building. You know, we train it. So after you train it, classify it, it does its little magic behind the scenes. It produces an output where it can tell me, oh, this is where the hardwoods, this is where the evergreens, this is where the water is, this is where the building is. It would produce this classified output. All right. And it kind of looks something, I'm gonna just, these are just screenshots, I'm not giving away any kind of secret information. But for an example, let's say a person had to hand digitize, right? They're not out in the field, they're just looking at images like, this is what it looks like if you digitize this. Well, our AI already created it in 2 days. And thousands of them in like 2 days, as opposed to having one person hand identify it on an image. Okay, one thing I would like to do, hint, 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 is to validate this. Let's do some ground truthing with this. That's the next step, is to add ground truthing and validate the effectiveness, the efficiency of this, and the accuracy of it. So this is just another example. How am I doing the time? Oh, almost out of time. Good thing I'm almost done. Okay. So here's some other examples. All right, I'm a public health person. I do love trees. Quick story, I have to share this. When I was a kid, did I tell you this? My poem?
No.
So when I was a kid, I was hardcore, like outdoors. I was like climbing trees. I loved being outside. And we had to do this thing in science, I can't remember. And I wanted to do something on trees. Because I thought, trees are the kindest things I know. They do no harm. They simply grow. They spread a shade for sleeping cows. And that's all I remember of the poem. So I was like 7 years old. Anyway, so I'm still into that today. I stay in tree houses. I like climbing trees, even today. I just don't do it in front of my children because that's too embarrassing. But urban heat islands. Have you heard of urban heat islands? Urban heat islands, yes? What is it? Explain this up. What is urban heat islands? You know what it is, right?
The city is warmer than the surrounding areas.
Yeah, why is that?
Impervious surfaces.
Oh my God, you spoke like a planner. We have so much impervious surface in a concentrated area. You're gonna have what's called this urban heat island effect, where the heat, it's exacerbated, right? And urban heat islands or extreme heat in general. You have extreme heat, which we're seeing more of, not only with frequency, but intensity. We're seeing more hotter days than ever, and hotter than we normally ever see it. Like, who would have thought that Germany, I spent time in Germany, and I'm thinking in Celsius, it was like 41 degrees for 2 straight days, 2 or 3 straight days, 41, which is like what, 105, 104? When I was in Germany, there's no air conditioning. There was no air conditioning, okay? The cities, the communities are not designed, not prepared for that level of extreme heat. Not just for one day, we're talking for the duration, okay? So this is a global threat. This is not just an American issue. This is a very much a global threat. But here we are. So I pulled this example. So Charlotte used the community to do a study. They had, for a day in July in Charlotte, they had a bunch, this is a friend of mine, she's a professor at UNC Charlotte in the earth sciences. And she had a bunch of people in the community take a phone and place them throughout the city. And during certain time blocks of the day, measure the air temperature, all right? She did this and then of course interpolated it. And of course, where you have the most impervious cover is where you have the highest temperature. Shocking, I know, okay? But Charlotte has, in the planning world, with the help of environmental nonprofits, Remember that public health system I had, like human and social services, there's nonprofits. Work with nonprofits. Develop a tree plan. Develop a tree canopy plan for the city of Charlotte with the idea of reducing the urban heat island effect, mainly to reduce urban temperature. Okay, now the next step of this, I plan on working with some folks there. I'm the public health person, so what's the human health impact of this? Is using EMS data. EMS? Guys, 911? Okay, good. All right. To measure what? Yeah, well, I think we all are. Using 911 data to identify where exactly certain heat-related illnesses took place in the city. Is there a relationship of syncope, which is fainting, hyperthermia, which is high body temperature, and dehydration? Okay, so like those are the three biggest easy indicators of heat-related illness. Heart attacks is another common one. Stroke is another common one, but some of the easy ones like syncope, dehydration, hypothermia. Where did that take place? Can we prove that not only is it good for the environment to have trees to lower temperature, but it's also important for public health to have trees, not only to improve air quality, to lower temperature so we can have lower rates of extreme heat-related illness. Does that make sense? So trees are great, okay? So I just noticed Charlotte actually has a really good tree canopy plan. I will say as a planner, it's a really cool plan. And they work closely with nonprofits, environmental groups to promote it. Okay, so this is just one example. I think I shared this with you is what can we do with this data? All right, it's not just contributing to the evidence base and publishing papers. I'm about research and action, research to policy change. What can we do to save the world and save people's lives? Okay, that's all I care about, right? And you're probably wondering about you. What happens when you leave here and we are already depressed by what's happening with the federal government? With money going away from climate change, money going away for public health. I mean, it's very depressing, I will tell you. I also will tell you that if you would have asked me 5 years ago that I would be working in a forestry industry, I'd be saying like, what, why? I'm doing public health and planning. No, there's no funding there. But the data skills that I have is transferable, all right? And I also have the mindset that everything affects everything. So if you have that mindset, you're open to collaborative partners and thinking outside the box. You're not limited to just this field. There's opportunities elsewhere as well with the same skill set and still achieve your passion. So what I think is important here is the point of cross-sector collaboration. Partnering with environmental agencies, public health and tech companies, that intersection can make a difference in terms of not only understanding what's happening with the environment, its impact on people and vice versa, but we can use that information for change. We can use it to justify, hey, we really need a policy about, hey, for every tree that's cut down for a new neighborhood, plant a new tree. Okay, Delaware has this. Delaware planning requires this. Any tree that's cut down for the sake of building a new neighborhood must have a new plant. It's required by law. Okay, it demonstrates how important the data is to policy change. Leveraging the community. We have data in our hands. I just use this as citizen science. So these are just examples of apps that you can work with. Okay, take advantage of this. We have these stewards in the community. They want to make a difference. They don't know how. Take advantage of them. Don't abuse them, but take advantage of them. I have a bunch of little girls who all they care about is animals. Take advantage of it. They may be 7, 10, 8 years old, but they know how to use a phone. Trust me, they know how to use a phone better than me. But I think what's important here is that everything that you do can be affected by other industries, other firms, other sectors, and understanding that you're not limited to just this box of forestry, for example. Forestry is trees, trees is planting, trees is green spaces. There's a whole movement about green infrastructure, nature-based solutions. Heard of it? Yeah, it's a climate-related mitigation strategy, popular in Europe, by the way. I'm not sure about this country. Are like nature-based solutions even a thing here? Sort of.
We would never.
What?
I made a joke, we would never.
So anyway, I just wanted to throw this out there, like, you know, in terms of where do you see yourself? It's seeing yourself as a collaborative partner, okay? Take advantage of the resources that are available in data science. It's already here. Take advantage of it. It gives you a competitive edge. Know how to collect data, know how to analyze data, use it to advance your policies, your programs, your initiatives. So that's the point there. So where are we heading? And AI is everywhere. AI is here. I mean, we can throw stones at AI, but it's here. Okay, we have to embrace it, but know how to embrace it. Learn how to embrace it. Learn how to use it effectively. Okay, and I hate using the word blockchain, but you know, blockchain is also a very I hate blockchain. But it's here. Embrace it. Okay, and you know, information in, process, information, another transaction, process it, boom, there's the blockchain. It's part of this transparent way of how information is exchanged, okay? We have this, it's, you know, the work that we're doing with EDR is using blockchain technology, that's what we're doing. And more importantly, see yourself as a collaborative partner with other disciplines. It will help advance what you're trying to achieve. Like I said, in public health, I can't change how people's health outcomes by myself as an industry. It's impossible. I have to work with planners and architects and environmental agencies and the churches, barbers, whoever, to help make change happen. If I want a food retailer, it's economic development. How do we drive in healthy food retailers? I don't know, tax-driven financing is policy, but we can try. We can try tax credits. These are all strategies that help advance what we need to accomplish for a better ecosystem and also a better community, improve the health. And with that, there's me hugging a tree. Do you have any questions? So do you have any questions? Please. Yes.
You're proposing models. Have you had a chance to, I mean, obviously you've ran models. Have you had a chance to implement policies based on those and then see if they actually worked?
Well, this is recent.
Okay.
So just know that anytime you, first of all, policy change takes time. Okay, I'm just letting you know right now, it does take time. So of course, changes into behavior is going to take time. However, did it change policy? Yes, it did. Okay, this sounds crazy. It's because it's the Dutch institution that was kind of flagshipping this whole